Medway NHS Foundation Trust has developed a really good working relationship with Livework, and that started really because we were interested in how we could develop some of the prison work, because they're already doing some prison work in the Netherlands. And actually, when I started talking to Livework around what they were doing elsewhere, I really started to get a feel for how they could translate what we really needed to do to develop the virtual hospital and really get it working in a way that was a fully operational and electronic patient journey framework, a fully interactive SOP, and for me, a way of ensuring that we had safe clinical governance across all the organisations that our patients were flowing through. And that relationship is just built and built and built, and we learn from them and they learn from us, so it's a great relationship.
Yeah, and that word that Tracy uses, interactive SOP, I think is the perfect way of describing what we're doing, is really building a dynamic tool so that the teams, the multidisciplinary care teams, can collaborate and align on the clinical governance or the processes that need to take place to build new capabilities, to monitor clinical pathways, or to just keep patients safe and really know and have clarity around who has responsibility for a patient at each point in time, what are we measuring for success, who's doing what, how can we evolve or innovate around the service. So really using it as a collaboration tool as well as a clinical safety tool.
And it's live, it's real time. So as we design, it's co-designed. We're working with Livework, Livework's working with us. And what we're doing is we're designing a much more modern way of managing the clinical governance and the pathways for our patients. And I think that's really progressive, and we're just going to keep developing that.
What that allows us to do, right, like our North Star is experience. So first layer is the experience for staff, having the clarity and the streamlined processes so that they don't have to waste their time wondering what the process or the policy is for something, or looking for something in a long
waiting on a phone
right,
for a switchboard to transfer a call.
Exactly.
It's all there for them.
And of course patient experience most fundamentally, so how we can align all of the pathways or all of the protocols that Medway is using around the patient experience, and really understanding what the patient journey is and making sure that each element of the service is designed with that patient in mind.
The challenges of a virtual hospital, we've started very much with an acute virtual ward offer, and a lot of trusts have an acute that discharges into a community virtual ward, and really what we've developed is an acute virtual ward with acute clinicians, and that's grown from 30 beds to 60 beds to 80 beds. We often have a bed capacity of 115, 120%, but for me it was the ability to be the SRO for the whole virtual offering for the Health and Care Partnership, and that is about working really collaboratively with our community partners, with our local authority partners. We have 7 prisons, so working with prison healthcare and HMPPS. And that was fundamentally the reason why I had a challenge around clinical governance. When you've got multiple organisations and one patient potentially flowing through them, how can I be assured, and how can I assure my board and our governors and our patients and our clinicians that what we're doing is collaborative, but it's consistent, and that we're providing care and that it's safe. And that was a real challenge, was trying to unlock that. And I think that's part of the reason why some virtual wards can be quite siloed, because each organisation has its own set of rules and regulations and policies and processes. And I wanted to break down that barrier, and that's been one of the reasons why this relationship with Livework has been so successful, because I had a vision in my mind of layers and how we work through that, and I really wanted to be able to provide that assurance of safety, of clinical safety, and that patient journey being seamless across these multiple organisations. So that in itself was a challenge, and it's a challenge we've started to really overcome. I don't think we've completely got to the end of it. I think that it will continue to be a challenge, especially I think in an acute hospital environment where we are trying to demonstrate that we can safely take these patients home, and we can give acute level care, or in some cases better than acute level care for these patients, and that our patients are safe, and that we do not have to do it within the confines of 4 hospital walls. So the 2 challenges, if I was to summarise, would be getting our acute trust colleagues and our clinical colleagues to believe in what we were delivering and the safety of it, and the second would be around how do we then assure everyone we're clinically safe, which is where Livework's come in.
Yeah. If you think about a virtual hospital with a scale like Medway's, 500 beds, I mean, that's massive, right? And they've got so many entry and exit points to the virtual hospital, whether it's coming from hospital, coming from the community, treating patients in prison. And that means a massive amount of stakeholders and a massive amount of complexity that needs to be adequately considered and designed for, so that we're capturing risks, so that we're managing clinical governance and all of that, so that we can assure referrers and clinicians that the service is safe, that we can make sure that it's safe, that we can generate the evidence behind it, and getting all of those sort of ducks in a row has been critical, I think, to be sure that the service is clinically safe.
And I think we've talked about metrics as well, Sylvie, haven't we? We've really talked about how are we going to measure it, what's our measurement for success, and there's not a lot out there data-wise for virtual wards, and what we're trying to do is be innovative. I've got 150 beds across Medway and Swale, across the multiple wards in our virtual hospital. My ambition in the next 12 to 18 months is let's increase that to 500 beds, and that's completely doable when we think about doing it differently and using technology and using systems such as a patient journey framework that's interactive, that everybody can sign up to, and then once we've got assurance and safety and clinical governance covered, then I think the rest of it's actually quite easy to develop.
The other challenge we've talked about is adoption, right? So anything you're doing something new, especially in a system like the NHS, where you've got clinicians who are working so hard every day delivering patient care, they don't have a lot of spare time, they're using a lot of different systems and trying to overcome a lot of technological barriers to doing their work well. And you're then saying, hey, we've got something new we want to try. That can be a tough sell, and what's been really helpful and really instrumental with Medway to kind of getting over that adoption curve is Jackie, their clinical lead, who's also been a champion for this change, super innovative thinking, bringing her staff in, showing them how they can use this tool, acknowledging that there's going to be a bit of an investment of time and thinking into that in order to really unlock change and see how things can be smoother and more patient-centric and staff-centric in the next.
And I do think there is a traditional challenge when we get anything technological. We often buy a box off a shelf and it will do ABC, but it won't do DEF because we haven't bought that capability. What we're doing is creating something around our need rather than somebody selling us something that they think is our need. So it's iterative, we're constantly working together, we're tweaking it, we're changing it, and it's a living thing. It isn't just one that you buy and then a year later it isn't fit for purpose. This is absolutely going to be fit for us.